Namaste. Good evening, Dr. Ashita. Namaste.
So can we start with our today's session, sir?
Okay. Okay, we are ready, Amma.
Yes, sir.
The link. Okay, Dr. Harshita, can I start, Amma?
Yes, sir.
I am audible?
Yes, sir, you're audible, sir.
Okay. So just a minute, Amma. I will share my slide.
Okay, sir.
चलो अच्छा हो गया, एक साथ हो गया. नहीं थोड़ा फिर इन्हें क्या सकता है नहीं आता इसको बताने ಸ್ವಲ್ಪ ವೆಲ್ಕಮ್ ಮಾಡಿ ಕೊಟ್ಬಿಡ್ತೀವಿ ಓಕೆ Okay, Om Dhanvantraya Namaha. Good evening, everyone. Good evening, all the scholars. And I'm thankful to all the organizer of tadvidyasambhasha for giving me an opportunity to sharing my views. And my special thanks to Dr. Saurabh sir for organizing this session. And I also give my gratitude to our principal sir, Dr. Madhav Digavi sir, Dr. Rajesh sir, all the HODs of our esteemed institution, TJMC Bellary, and to all my PG scholars. So today, as today, the organizers have given me the topic Trishothiya Adhyaya. Okay, Trishothiya Adhyaya. So before going to this chapter, I'd like to have a brief discussion about this chapter. So, as all of you know that, can you hear me? I am audible?
Yes, sir, you're audible, sir.
Okay. So, the Trishothiya Adhyaya, which comes under 5th Chatushka, that is Roga Chatushka of Charaka Sutrasthana, it contains 17, 18, 19, 20. So it's better if you see in brief about the Roga Chatushka before going to our 18th chapter, that is second chapter of Roga Chatushka. So in the first chapter of Roga Chatushka, 17th Kiyantiya Shirsha Adhyaya, where the Acharya Charaka explained about the Vyadhis which are specially related to the Uttamanga, and also explained about some other Vyadhis like Prameha Samprapti, Avanidana Samprapti, and even Prameha Pidikas also. Okay, so apart from above, even we can see the importance. Of Lakshana, how they plays important role in the diagnosis. How the different types of sampraptiks like Shayas plays its role in the establishment of Vyadhis, and also how they are helpful in the treatment of the diseases were discussed in brief. So further, in the very next chapter, that is Trishothiya Adhyaya, Trishothiya Adhyaya were explained. So before starting our today's chapter, I want to gain the attention of all our scholars regarding some important useful things. As it is very clear that today we are trying to understand the Trishothiya Adhyaya, isn't it? So, but before going to read or before going to discuss in detail of this chapter, let us try to understand and reveal the classical bhavartha of Shota. Okay, rather than what we think, what we understood, that's not a matter here. So in general, the perception of word Shota means it's just merely a swelling. Okay, so when we study our classical Charaka Samhita, it made us to think on several aspects, like how our Acharya Charaka wrote this Shota Adhyaya, what might be in his mind, what might be his ideas, what might be his thoughts and so on, beyond explaining the Shota. So, because particularly when we compare the concept of Shota of Acharya Charaka, seems to be very unique when you compare with Vagbhata and Sushruta. So, as just now I told, in general public, if you ask anyone what is Shota, so first picture, thought, or image comes, and all of our mind is edema. That too, particularly pedal edema, that is pitting or non-pitting, or maximum we can think about facial edema. That's like a puffiness of face. That's all. Because knowingly, unknowingly, we got such mental impression or psychological imprint in mind that Shota means just a swelling. That's all. Okay. But when we start to read and go on trying to understand our Samhitas, especially Charaka, we came to know its real depth of concept, that too in its real sense, as well as we also can understand its various angles, but just not like a general public, not like that authors who wrote their translated text in English, Kannada or Hindi or any languages. So in fact, our Acharya Charaka not just limited the Shota just up to earlier up to either pedal edema or puffiness of face. Rather than, it is a very important and very vast subject which can be only understand or known or presumed when we read it, not only by simply reading, try to understand this concept, that too by applying our yukti, that too with much concentration with presence of mind. And most important is one should try to read, or one should study under the blessings and guidance of teachers. So with this, I'll start the Trishothiya Adhyaya chapter. And regarding the reference, I am only focusing on Charakas today, not Sushruta and Vagbhata, particularly Charaka. When we read Charaka Samhita, we can find 2 chapters exclusively on Shota. First, we found in 18th chapter in Charaka Sutra Sthana, that is Trishothiya Adhyaya, and another chapter in Charaka Chikitsa, 12th chapter, Shota Chikitsa Adhyaya. So another thing to notice in Charaka Samhita is, generally Acharya Charaka, his pattern is different. He explained Samanya Hetu, Samprapti, Lakshana, Sadhya Asadhyata, and little bit brief treatment, that too supposed to describe in the Nidhana Sthana. General, it is a general principle of Charaka Samhita description. But like Jora, Rakta, Pitta, Ashta, 8 chapters of our Nidhana Sthana. But their details are supposed to be explained in Chikitsa. Okay, this is a normal pattern of explaining Charaka in Charaka Samhita. But some of the diseases are there which are directly explained in Chikitsa Sthana without explaining its basics in Nidhana Sthana. We everybody know that there are so many, other than 8 chapters, all other remaining chapters were explained in Chikitsa. They are not described, or they are not discussed in Nidhana Sthana. It's another pattern, in another thing. Further, if we read all chapters of Charaka Nidhana Sthana, we cannot found a separate chapter in respect to Shota. But when we read Charaka Sutra Sthana, 18th chapter, okay, the 2nd chapter, Roga Chatushka, we can find one exclusive chapter, namely Trishothiya Adhyaya. By this, it shows its, in the sense, Shota, Vyadi, importance as well as its uniqueness. Okay. But one doubt comes in mind, once again, that yes, if the Shota Vyadi seems so important, particularly clinically, then instead of explaining in Charaka Sutra Sthana 18th chapter, Acharya would have been explained in Nidhana Sthana. Okay. Then why not Acharya Charaka explained this Shota in Nidhana Sthana? Maybe reasons, there are so many reasons we cannot presume, but after all, seeing the whole references, Acharya Charaka was explained separate chapter dedicated to Shota as Trishothiya in Sutra Sthana 18th chapter, which means maybe explain this topic Shota in Sutra form, in brief or in short, and further in this Vishaya or these things will going to explain in detail in Chikitsa Sthana. Maybe this is one might be the reason why Acharya Charaka explained our Trishothiya Adhyaya Charaka Sutra Sthana. And I think even after above clarification or discussion, still same doubt in mind that why not in Nidana Sthana? Once again, okay, this Shota as explained. So to know this reason, so once again we have to just look after the previous chapters, okay, to understand this. First of all, we have to recollect or recall or remember the Chatushkas once again. Check this Trishothiya Adhyaya is explained under which Chatushka, and we already, just I told you, it comes under Roga Chatushka. It's very clear. Further, to understand, need to go back that in Charaka Sutra Sana 17th chapter, very first shloka, Chakrapani commented, Purva Chatushko Chatushtena Bheshajam Abhihitam Sampratim Tad Vishaya Roga Abhidhanartha Roga Chatushte Abhidhanyaha. So here Chakrapani telling, as in the previous Chatushka, the Acharya has explained various aspects related to therapeutic measures. As you know that previous Chatushka is Kalpa Chatushka, Kalpana Chatushka, where we will get 13th, 14th, 15th chapter respectively Snehana Svedana and Vamana Virechana. So here Acharya explain various aspects related to the therapeutic measures. Okay. So in this present Chatushka, isn't in Roga Chatushka, he is related to enumeration of the Rogas, Vikaras, or the diseases. Because in fact, these Rogas are the real objective of the therapeutics. Okay, that is the Rogas means Vadis, which constitutes the objective of the such therapies and procedures. So that's why here in the 17th chapter, Kiyantiya Shirishya Adhyaya to 20th chapter, Maharoga Adhyaya, Acharya Charaka was explained about Rogas, Vikaras or Vadis and its related Vishayas. Further, we came to know that Acharya Charaka Acharya Chakrapani in Charaka Sutra Sana 17th, same continue in commentary, he explained Kim Darshitasya Ayam Pratamo Adhyaya Eva Sambandha Evam cha Angeshu Marmesu cha Pradhanabhuta Shiraso Hrudaya Rogaha Abhidhanakatvena Kiyantah Shirsha Abhidiyate. So here Chakrapani clearly telling us the treatment of the Rogas plays an predominant role, and same has been explained in the first three in the sense 13, 14, 15 of the Bhesha Chatushka. Further, in the present, in the sense 17, 18, 19 Chatushka, Acharya Charaka is going to explain about Roga, means Vikaras. That too, first of Roga Chatushka, 17th chapter, gives the description of Roga, specially explained related to the Siras and Hridaya, because they are marmas. Okay, they are one among three marmas, as they are the most important amongst all angas, including marmas, vital part of the body. So, further, if you move to our Trishothiya Adhyaya, first chapter of Sutrasthana, that is 18th chapter. So here, very first Chakrapani commentary is Puro Adhyayo Pidakaha Uktaha Tatasya Shotaha Rupam. So, Ataha Shota Adhikara Trishothiyo Abhidhiyate. Means here Chakrapani, very first shloka, he is giving the hint that why he has selected the Trishota only here in 18th chapter. Purva Adhyayo means in the previous chapter, Pidikas are explained in detail. Pidikas, okay. You might ask, you might have a doubt that no, in the 17th chapter, not only Pidikas, only explained about Pidikas, or there are some other things also. Yeah, of course, there are some other things also. But as Pidika is the main thing explained there, that's why Tatasya Shota Rupaha, that Pidika, because that Pidika is Shota Rupaha, Shota Swarupaha. So Shota is being described in this Charaka Sutra Sana 18th chapter. Okay, that is in the last chapter, as I told, Charaka explained about Pidikas. So same, Pidikas are nothing but they are the form of Shota Rupaha or Shota Swarupaha. That's why in coming shlokas we came to know Utseda Matra Samanyad Shota. This is the main clinical or cardinal feature of Shota. So Pidika is also Utseda Matra. So because of that reason, to continue the same topic, Acharya Charaka, after explaining 17th, in 18th chapter, he started the chapter name Trishothiya Adhyaya. Okay, it means even the Pidikas are also similar to the Shota. Utseda Matra Samanya Shota. So such Utseda of doshas can be occurred in any srotas. Okay, any part. It may be Bhaya or Abhyantara also. It may be in Pranama srotas, it may be in Rasava srotas, it may be Raktaja, and so on. Hence, the Shota means does not limit only up to the pitting or non-pitting or swelling in the knees or ankles or puffiness of face. In fact, it is more than that. Okay, so just if you come across any road traffic accident, if she or he had any cerebral edema, then what is your diagnosis? Okay, how should we think? How one should understand it? Okay, this everything comes from Shota only. This the cerebral edema is also kind of Shota, but it is not the Abhighataja. It is Marma Abhighata Nijadosha Prakopajanya Shotaha. Okay, so even if you go for Raktava Srotas, if Raktava Srotas get vitiated by doshas, produces by producing Sangha or some slightly Utseda, then also that Sangha also considered under Shota only, because all the things nowadays we are getting hyperlipidemia, some atherosclerotic changes, thrombosis, or you can take varicose also, or you take pulmonary embolism or any blood clots. All comes under Raktavaha Sroto Janya Utsedaha. This is also Shota. So even though once again after discussing everything, Shota is Bhaya, Abhyantara, it's a different thing. We will discuss in detail in coming topic. When I start to discuss Samprapti, there I will highlight on the Bhaya Abhyantara kind of Samprapti there. Okay. So after discussing everything, even though once again the same doubt in mind, why Acharya explained Shota Vyadhi, why not other? Of course, in Roga Chatushka, he would have explained some other so that with reason, as I already told, one is Pidika. In previous chapter, explained Pidika. Further, the understanding of Vyadhi Rogas is not so simple as we think. So Acharya Charaka explains and provides a complex or complete fundamental understanding of pathogenesis in a concise or brief or short manner in this 18th chapter. This is very important. Further, in this Roga Chatushka, provides importance of understanding of disease pathology, understanding of the disease, diagnosis of the disease, and understanding the determining of effective treatment as also seen in this your Roga Chatushka, particularly in 18th chapter. The Roga Chatushka provides a complete fundamental understanding of Samprapti in concise manner, in very brief or in very short. Okay, and it also provides an insight from the basic fundamental of disintegration of the dhatus, dhatu samyata, and subsequent manifestation of aparisankhya vyadhis also. This we will discuss in the 40 shloka in this chapter. Okay, how they are going to establish. So, if we come to our 18th chapter, Trishothiya Adhyaya, that is present chapter, the process of Sthana Samshaya is the best example for Shota, because with much concentration on Adhisthana, further it classifies Adhisthana under major two heading, like Samshaya Sthana and Vyakta Sthana. Further, when we read, and we came to know that in this chapter, Acharya Charaka has quoted that it is not possible to name all the Vyadhis. In 42 shloka, in the same 18th chapter, Charaka explained aparisankhya, means it is not possible to name all the Vyadis as the Vikaras as aparisankhya. They are innumerable. But to minimize the error in the treatment and for the accurate diagnosis of the disease, a general protocol is given in the form of Trivida Bodhya Sangraha. It is there. We will see all the shlokas in coming in next our discussion. So Trivida Bodhya Sangraha means that is Trivida. What are those? Vikara Prakriti and Vikara Adhisthana and Vikara Samsthana. These are very important. So what are those? Vikara Prakriti means nature of the roga. Vikara Adhisthana means the different region of localization, means Adhisthana. And Vikara Samsthana means special causative factors. So, as ultimately the disease should be treated with this Trivida Bodha Samgraha only. So, as the knowledge of this Vikara Samutthana, Vikara Adhisthana, and Vikara Prakriti is very important. Okay. Thus, the Roga Chatushka provides a general protocol for diagnosing all pathology and must for every physician to ascertain or to find out them for a successful treatment. So, Acharya Charaka might thought that in all aspects, the Shothavadi is to be very suitable and appropriate disease to explain here in this Roga Chatushka Adhikarana. And as a Shota Roga is a such Roga which cannot limit to one place. That is, in Shota we can see so much of variations, changes, diversities and fluctuations due to so factors like allergies, bites, cuts. We'll see in the hetus. We'll find out. We'll get so many hetus for the formation of Shota. Similarly, the Shota is not only an independent Vyadi, it is a Lakshana and even a Upadrava in so many other Vyadis also. Further, the Shota may be Ekanga or Sarvanga. It is Abhyantara or Bhaya. It is caused by Alpadosha or Bahudosha. It may be Nija or Agantuja also. So, if we say, in short, we can say that the Shota has its very wide range and in all aspects. So, as the Shota will exhibit, manifest and produce in body by the various dosha anubandha, like in different size and form, it may be mild or moderate and severe. Based on the size, it may be small, medium and big. Based on the color, it may be Shava, Pita, Shweta Varna. Based on the hardness, it may be soft, moderate and hard. Based on the body effect, Ekanga, Sarvanga, etc. So on. So, hence, based on these and many more criteria, the Vyadi becomes aparisankhya. So, this aparisankhya cannot be explained with any other kind of roga other than Shotaha. So, might be because of all above reasons, Acharya Charaka may thought that maybe, and it's my opinion, Shota may be the right on appropriate or correct kind of roga to be explained here in this Adhikarana, that is Roga Adhikarana, second chapter. To mention as the best example to understand the Roga concept. Maybe because of all above discussed reason, Acharya Charaka might explain Shota Roga as the 18th chapter of Charaka Sutrasthana by leaving so many other Agre Rogas or Daruna Rogas. So, we can say that the Shota is a representative of variabilities. Okay. So, as such, variabilities generally cannot be seen in any other Vyadis. So, it shows or indicates the importance of Vyadi Roga Shota, importance of Shota. Okay. Thus, with this brief introduction, with very valid reason, we will now move to our 18th chapter of Sutrasthana, that is Trishothiya Adhyaya. So, first shloka is, so let me start. Athata Trishothiya Adhyayam Vyakhyasamaha iti hasmaha Bhagwan Atreyah. So here as we all of us know that athata is a what you called Mangalavachika Shabda, will usually frequently seen in all the chapters while starting the chapters. So after Kiyantiya Shirshadhyaya, Acharya Charaka has came up with discussion on Trishothiya Adhyaya. So as we discussed in Chakrapani, the very first he told, Purva Adhyaya Pidika Uttam, Tatasya Shota Rupaha Atha Shota Adhikaraha Trishothiya Abhidiyate. So here, once again, I don't think it's need of discussion. Already I told in the previous chapter, Pidikas are explained. Not only Pidikas, along with Pidikas, they explain things, but Pidikas are, as the Shota is one of the features or Rupa or Swarupa of Pidika. So the present chapter entitled Trishotha is going to be describing. Okay. So to continue the same subject, we are explaining Trishothiya Adhyaya. They are continuing the same thing. Pidikas, thereafter Shota. So it means Pidikas are nothing but Shota Rupa only. They are Sota only. Okay. So here one question arises once again in mind. Of course, yes, of course, we convinced that in previous chapter they explained Pidikas so, and to continue the same topic, we started with Trishothiya Adhyaya. Yes, we agree. But why Trishothiya Adhyaya? Why not only Shothiya Adhyaya? Acharya would have explained with Shothiya Adhyaya, like Gulma Adhyaya, like other chapters. Okay, then this might be the reason that here as a Shota is a three types, and that's why it may be named as Trishota only, because first shloka of our chapter after we start with Trishota Bhavanti, isn't it? So because of that reason, might be the chapter name has been named Trishotaha. Okay, and then once again may I ask, if it is so, why not like other chapters, Saptajoraha Adhyayaha, Panchagulma Adhyayaha, Vimshati Pramya Adhyaya, like that. The Acharya may not maybe they would have explained like that, but for that, I told that I give some example there, that each such similarity example we can see in our Apamarga Tandula Adhyaya also. In second chapter Sutrasthana, just you see the first shloka start with Apamargasya Bijani, like that. So the chapter named as Apamarga, and even Kiyante Shirisha, that our previous chapter, the first chapter of our this Adhikarana, Kiyanta Shirsa. The first shloka of word is Kiyantaha. That's why Acharya might started with like Kiyantiya or Apamargya or even Trishothiya Adhyaya also. Okay. So next, the Acharya will start our third shloka. That is Trayoshwata Bhavanti Vata Pitra Sleshma Nimittaha. See what it means. Trayoshwata Bhavanti. Generally, what we understood, there are three types of Shota. Okay, no doubt. Shotaha Traya Bhavanti. Okay, or anything. Or Vata Pitta Sleshma Nimittaha. What it means? Vata Pitta Sleshma Nimitta means Nimitta. Nimitta means Karana. Karana means for what? For Shota, three Shota. What are those? They are Vata Pitta Kapha. It is in this way meaning. It doesn't mean that three Shota Bhavanti, Vata Pitta Kapha. Three Shota means Vata Pitta. It's not like that. Those three Shotas are for that Karya, Nimitta Karana is three doshas. Due to this Vata Pitta Kapha are the Nimitta Karanas to produce the three Shotas. In this manner, Acharya is going to explain this shloka here. It not simply just as we think three Shotas, three means Vata Pitta Kapha. It's not like that. These doshas are the Nimitta Karana to produce that three or maybe 6 or 7. We'll see later. Okay. So reasons, as we all of us know that dosha eva sarvesham rogana meka karanam. For everything, we it is not necessary. I think we'll discuss here. Dosha are the main core concept of our Ayurveda. See, simple Ayurveda is three sutra Ayurveda. Simple, I simplify as if I because like three sutra. It is a best example for a concise our Ayurveda. Hetu linga aushada. That's all, simple. Hetu they won't cause any disease. Hetu, to produce linga, in between there is one factor, that is dosha. Hetu will always influence on doshas. Dosha will vitiated due to the hetu. After vitiation of dosha, they will get vitiated doshas and produce some lakshanas and chikitsa. That's all. Hetu linga aushada. Here, the hetus, dosha is a core concept. Without dosha, there's nothing in Ayurveda. So here also, these doshas are themselves are the nimitta karana for to produce the shotas. That's Acharya I want to tell here. Okay. So further, next okay. Te punah dvidaha nija agantu bhedena. Te punah, the second part of the shloka, te punah dvidaha, okay, nija agantu bhedena. So here, te means what? Te means shotaha. Just now we read. Te. The shotas are once again two types. What are those? Nija agantuha. Okay. It's simple. It seems once again very simple shloka, but it's not like that. Just I will explain what it means. It means same evo means three shotas, te, which are caused by vata pitta kapha. Okay. They are two types. Nija agantuha. Okay. I think it is clear. And if anything doubt, I will clarify. So if you read carefully once again, those vatadi shotas are bhinna, and once again the basics of on the basis of nija agantuja, nija vatadi doshas shotas are bhinna and agantuja shotas are bhinna. That's why Acharya Charaka wrote te punah dividaha. Te punah dividaha nija agantujaha. Means here nija, here doshas are bhinna for nija shota, and even here doshas are bhinna for agantu dosha also. That one and same. Of course, three doshas are there, but the process is different. Okay, I will conclude. So now, according to vatadi shota of nija hetus are of three types, and vatadi shotas of agantuja hetu also separate three types. How? We'll see. Okay. So here the word te, it is not simply reminding us about that the shotas are of three types. Yes, it is, but it is not only that. Here, if you once again read and try to understand, Acharya also saying some sukshma vishaya here, some very minute and some very sukshma vishaya by using punaha based on the hetus. So dividaha punaha, dividaha nijaha and agantuha. Nijaha means caused by nija hetu and produces shota, and agantu caused by vata first, then very next there also the visheshan of dosha taken place according to the agantuja hetu and produces shota. It's clear. Then the question arises: what is it normal? Na? It is normal? What new in it? Yeah, of course. In both kind of shotas, either nija and agantuja, there will be the visheshan of dosha taken place. It's clear. In both, either nija or agantuja. Okay. It is must and should. There is no button. No, there is no other way. There is no question. Okay, but still, if you read and try to understand this shloka, the hetu of visheshan of vata doshas for producing shotas are different, bhinna, based on the nija and agamta shotaha. So that's why Acharya might wrote the word te. Te means shotaha, which are caused by nimitta. What are the nimitta? Vata pitta kapha. Punaha means again and further. Dividaha classified into two types. That is nija and agantuha. So hope I think are you getting some idea what I want to tell? So vata pitta sleshva nimittaha trayo shotaha. See, just vata pitta sleshma nimittaha trayo shotaha. Punaha nija shota bhedena binnaha agantu bhedena binnaha. They are different. Okay. So it means not only the nija dosha, even the agantu shotas are also of vata pitta kapha. Here Acharya want to tell this. Nimitta karana for producing primary cause is tridosha. Okay, abhyantara hetus. But for agantuja Of course, there may be some aghata, anything, we will see. But secondary, very next, the doshas involvement also be there in even Agantujada also. That's why Nimitta, Vata, Pitta, Kapha are common for both, either primary or secondary. This also here Charaka, Acharya Charaka is covering this meaning. So, we should not forget this ever due to any allergens either by dust, cream, polluted water, whatever may be. Definitely the Vatha is first. There also will be the involvement and the vitiation of Vataja dosha very next. That's why Acharya Charaka, even for Agantuja Hetu, explained the Nijatva. So similarly, here in this context also, there will be a vitiation of Nija doshas. That's why the shloka can be elaborated and try to understand like that. Te vata nimittaha nijaha, te pitta nimittaha nijaha, te sleshva nimittaha nijaha, and similarly, te vata nimittaha agantuhu, te pitta nimittaha agantuvaha, te sleshva nimitta agantuvaha, bhedena dividaha. So, in this way, if you try to understand this shloka, then we'll get a clear idea. Because if you want to understand further things, we need to refer some other things also. We'll do in later in coming shlokas. So if the time permits, I'll definitely explain, especially in Charaka Chikitsa 3rd chapter 113 to 114 and Charaka Nidana 1st chapter 30 shloka. There you will get the description about what you call Agamtuja Hetus. Okay, they are very important to understand this Shota also. So, no doubt, in all Nija Shotas, definitely there will be involvement of and vitiation of Nija doshas according to the respective Hetus. Yes, no doubt. And Nija doshas are themselves are the Pradhana Nimitta Karana in producing Shota. Okay, not Hetus. Hetus, they don't do anything. Though Hetus, they only vitiate the doshas, and these doshas are the Nimitta Karana for producing Shota. Shota and so, any disease. Similarly, even in Agantuja Shota also, Acharya once again reminding us that here also there will be a definite involvement of Nija doshas, but little bit later in producing the Shota. That's the only different. So further this shloka, te punaha dividaha Nija agantu bhedena, means here same thing we can also be understood in another way. Nija Shota means dosha nimittaja and abhyantara, and agantuja Shota means abhighataja and bhayaha. May including in abhighata means abhighata, not only abhighata, agantu, we will come across bhuta, upasargadi, everything, which is explained in a 20 chapter. Okay, with this त्रयो श्वत भवन्ति वात पित्त श्लेष्म निमित्तः ते पुनर्देविदः निज आगन्तु भेदेन. Okay, next to the same thing in the very next chapter, that is in 19th chapter, third shloka, sub 6 shloka, will come across त्रयो श्वत इति वात पित्त श्लेष्म निमित्तः. Same thing explained while explaining in Ashtodhya Adhyaya, while explaining so many classification of rogas. There we see the Shota, if you see about Shota, Trayo Shota iti Vata Pitta Sleshma Nimittaha. There also these Vata Pitta doshas are the Nimitta for the production of three Shota, Nija Shotas. Okay, not three Shota means Vata Pitta Kapha. It is not like that. These are the Nimitta Karana. What? Doshas. Okay, similarly, same explanation as that of our Trishothiya Adhyaya. So, but once again, here the doubt comes, because when you go and if you go and see in this same chapter 18, 7th shloka, where there we found that Saptaha Vidaho Bhedaha. We see 7 types of shotas. Okay. So, but here in this male shloka, as Trishothiya, they are not explained as a Sapta shloka, Sapta Shota. But in later in 7th shloka in the same chapter, Acharya also explained Tridvandada and Sanipata also. Okay. So, So you will see later as the Adhikarana comes, I will explain there. Thus, the total number of shrotas are in 7 actually. Okay. So next shloka. So let's move to our fourth shloka. So now we'll discuss about the Haganto Hetu. Okay, but before going to read fourth shloka, one thing we need to observe and is in very next shloka, that too in our special, because as we are reading Charka Samhita, it's not a Shalya Pradhana, any Shalya or Vagbhata. It's Charka. Okay, Charka is, as we all of us know, that it's a what you call. We are Charka Acharya Charka was not given much focus on any Shastra Chikitsa or any Shalya Pradhana type of treatment. But as per our sequential order of explanation, while explaining the types of Shota, Acharya explained Nija and Agantu. It seems to be common. It's a routine process. Nija, Agantu, Nija. Wherever there is explanation of or classification of Vyadhi, first they prefer Nija and next Agantu. But here in this Adhikarana, where Acharya is going to start with explanation of causes with Agantuja, not Nija here. Instead of starting Nija Hetu, Acharya started to explain the very next 4 shloka regarding the Agantu. Okay. Why? What might be the reason? What message you want to give here? Just we have to think. Because it means it shows, in spite it is Kaya Chikitsa, as I told, Kaya Chikitsa Pradhana Shastra, even Acharya Charka was very well aware, and he might think that the Abhighata, Agantu Hetus are also having the very important role in the Agantuja Nidana, especially in Shota, in the formation of Shota. Maybe due to this reason, Acharya might explain the Nidanas, Hetus of Shota with Agantuja Hetu rather than Nija. Okay, that's why if you see the 4th shloka for Charaka Sutrasthana 18th chapter, he started to explain with Agantuja Hetu only. So here, Tatra Agantuvaha, Chedanaha, Bhedanaha, Kshanana, Bhanjana, Pichana, Utpeshana, Prahara, Vada, Bandana, Veshtana, Vedana, Pidana Adibihi, Ballataka, Pushpafala, Rasa, Atmagupta, Shuka Krimi, Shuka Hetam, Patra, Lata, Gulfa, Samsparshanaiva, Svedana, Avamutranaihi, Sa Visha, Prani, Damshta, Danta, Vishanam, Naka, Nipataihi, Va, Sa Garavisha, Vishavata, Hima, Dahana, Samsparshanaihi, Va, Shotaha, Sama Upajayate. Here, Acharya Charaka explaining the some important hetus for what Agantuja Hetu, Agantuja Shota Hetu. So here, if you once again, you can differentiate certain things like Chedana to Pichana. They are explaining only superficial causes, superficial injuries. Okay, and if you see Utpeshana to Pedana, they are like some putting extra pressure, external pressure like that causes are there. If you see from Ballataka Pushpa Falarasa to Gulfa, Lata Gulfa, Samsparshanehi, there seems to be like external irritants. And if you see Savisha and all those things, there seems to be like poisonous things. Okay. Some natural things also, some like Garavisha, Vishavata, there seems to be like some natural things. When the patient come in contact, he will produce, he will have Shota. So Chedana is the first. Chedana, due to the excision type of injury, Abhighata, the person may get Shota. Chedana is, in fact, it is a therapeutic act also. It is a procedure of removing shalya in Shalya Tantra. And Bhedana, once again, it's a therapeutic procedure. Incision, due to incision type of abhighata, maybe patient may produce, have shota. Kshanana means commuted fracture, like broken type of bones, two pieces like that. In that abhighata also, the patient may have shota. And bhanjana means Chakrapani told, bhanjana asti churnanam, means here joints, joint injuries or joint fractures. And pichana means contusions. Chakrapani here explaining athyartha pidanam, means contusions is an injury to tissues usually without laceration, means it's a tear in superficial skin or flesh, that's all. So here, due to the above different types of abhighata, maybe the person may get shota. So next, as I told, this chedana to pichana seems to be some superficial injuries. That's all, not deep. Okay, not deep injuries. We will see in while reading our Charaka Chikitsa 12th chapter. While Samprapti, we will come across what is Bahaya Abhyantara, like that. Okay. So next, Utpeshana, Prahana. Utpeshana means exposure to excessive pressure. Okay, Utpeshana. And Prahana means like injuries. Vada means beating, like beating. And Bandhana means bandaging. Or Veshtana means Agranti Bandhana means anything that surrounds, okay, without knot. And Vedana means piercing, like, and Pidanadibihi. There is a compression type of pain. So these seems to be as like they're set of like putting some extra pressure on body, on external surface. So due to all this, the person may have the shota. So next, Acharya Charaka is explaining some external irritants, allergies like Bhallataka Pushpa Phalarasa. Here Bhallataka Pushpa Phalarasa, Bhallataka mainly as an example might given here. Maybe we can take some other phalas also. Okay. Atmagupta, Vanari, everybody know that Atmagupta, Vanari. This is also one type of, if the person come in contact with Kapikachu, the patient definitely have like arterial rashes and itching. And Shakha, and Krimi, okay, bristles of poisonous insects like mosquito, ants, bees, etc. Or bristles means stiff hairs or feathers, such small insects. And Patra also, creepers, Lata, and shrubs. If you come in contact with some harmful leaves, creepers and shrubs, then also patient samsparsha nahi hai. If you come in contact with these things, maybe patient may have shota. Okay. Next, Swedana avamutranaihi. You see, Chakrapani avamutrana means crawling, what we call crawling, moving slowly on body. Example, contact of any poison insects or creatures like their sweat, like mala, mutra, when they are falling on our body, okay, during their crawling of insects, they will like cockroach, ants, or bedbugs, or spiders, termites, scorpions, etc. Due to that, these are either sweat or mala or mutra, anything. When they fall, when they come in contact with our body, patients, some person may have some type of allergies. Okay, Savisha prani, like snakes, dogs, cats, tiger. What Savisha prani? Damstra. Okay, damstra, fax means a long, sharp teeth. Okay, Danta, long teeth. Nakha, long, nails. And Nipataihi, long horns also. So due to these poisonous animals, these things, when they get abhighata, when they get injury by these things, once again the patient may have shota. And next is Krutrim, Garavisha, Vishavata, Hima, Dahana, Samsparshani. Once again, Samsparshani. So when you come in contact with these things like Krutrim Vishaha or artificial poisonous wind like air, or exposure to oceanic winds or poisonous winds or snow like Hima, Dahana means fire. So once again, patient may have Shota Sama Upajayate. So So because of all the above causative factors like Shota will occur. So have you noticed anything important here? Okay, so one thing, just Shota Sama Upajayate. So this, as the Adhikarana is, we are discussing Adhikarana today, especially in this fourth shloka, is Agantu. Okay, this is Agantu Hetu. But when you see any Nija Hetu of any rogas, there what will found? Vayu, after Hetu, Vayu Prakopam Apadate, Pittam Prakopam Apadate, Kafam Prakopam. There they won't tell this Hetu what Jaram Upajayate, Gulmu Upada. They won't like that. They won't write like that because this is a Abhighata. Vetha already occurred. Later on, doshas are going to involve. That's why directly Acharya told Shotam Sama Upajayate. Here directly Shota occurred. Later, very next fraction of second, maybe next fraction of minutes, maybe fraction of hours, doshas definitely get involved, and treatment should be given to once again to doshas, not the Vetha. Okay, so similarly here we have noticed that Shota Sama Upajayate, not like in Jara. If you go Nidanasthana, first chapter 19, 22, 25 respectively, Vata, Prakopam, Pujayate, Pittam, like that. But it is not like that because it's a Agantu, not Nija. Okay. So, but in Charaka, Sutrasthana 18 chapter 4 shloka, at last he wrote Sota Upajaya because this is the only one reason. So next, I will discuss next shloka. Next, we will discuss so further, for further clarification, just I want to open Charaka Chikitsa. Charaka Chikitsa 12 chapter 7 shloka. So let's move to further that shloka because there in Acharya Charaka, there in Charaka Chikitsa 12 chapter 7 shloka is once again Adhikarana is the Agantuja Hetu only. They are also very important here. In order to understand perfectly, I took only 2 to 3 shlokas from Chikitsana, only that to Charaka only. Okay, not all shlokas, because it is very important to understand our Sampradaya. That's why I took this shloka here. I am discussing this shloka. The shloka is 7th shloka. Charaka Chikitsa 12, 7th shloka. Bahyastvachaha. So here, Acharya Charaka is explaining Bahyastvachaho Dushayita Abhighataha Kashta Ashma Shastra Agni Vishaya Sadhyaha Agantu Hetuhu. So here once again we see the same Adhikarana. The chapter is different, but topic is same. Here in 18th chapter we are discussing Trishothiya. The same will continue and discussing Agantu Hetu only from 12th chapter. Okay, so Bahyastvachaha. Here see, Acharya explained here Bahyastvachaha. We'll see later what is Bahyastvachaha. Dushayati. So due to the Kashta, Ashma, Shastra, Agni, Visha, and Saddaihi means iron, Agantu Hetu, because of all this Hetu, Bahyastvachaha, the injury on a Bahyastvachaha only, not he is explaining Bahyastvachaha, that's all. We'll see what is Bahyastvachaha. Okay, so in any kinds of due to any kind of injuries to the Bahyastvachaha or any contact with Agni, Visha, so and so. You see, Agni won't cause any ghata. Okay, when it comes Samsparsha, when it come in contact with Agni and Visha, it is not kind of Abhighata, it is Samsparsha. That's why in fourth shloka we saw some category Acharya Charaka explained Samsparsha. Some he told Abhighata. Okay, so ultimately the Bahyastvachaha is going to suffer. So when there is a exposure or injury to any external skin by the impact of Kashta means wood, Ashma means stone, Shastra any sharp or blunt weapons, Agni and Visha contact Samsparsha, and Loha Abhighata give rise to the Agantu Shota. Okay, so here we see the Chakrapani commentary. What is Bahyastvachaha? It's very important here. Here Bahyastvachaha word is very important in this shloka as as by the word what do you call it? By the using the word bahayatvacha, acharya charaka is limiting the limitation of injury, or the depth of injury, or the seriousness of injury. See, otherwise the acharya charaka would have not used the word bahayatvacha. He would have used only tvachaha. But here, particularly in the 7th shloka, he using the word bahayatvacha, only external or superficial. As I told in 4th shloka while explaining 13th chapter, external injuries, that to superficially, first set. Okay, similar meaning he is here also. Acharya charaka is giving bahayastvachaha. See, in Chakrapani what he told, bahayah iti agambiraha, means we should not read. We should read in another way. Tvachoho bahayah, or bahayatvacha means tvachoho bahayah, means injuries on tvacha, that to bahaya, superficial only. It means the injuries only superficial, not deep-cutted injuries. It's very clear. By this word, Acharya Charaka clearly bifurcating or giving the limitation of injuries. Because if deep injuries occurs, it's a different disease. It may be mamsa, dharakala, what you call, abhighat janavadi. It's a different, it's not comes under Shota. The same thing is explaining here Chakrapani. Now, let's see the Chakrapani in other continuous explanation. Etena gambiratvad dushakatvad shotena na bhavati. See, here Shota is bifurcating, he's differentiating, he's showing the limitation that bahayastvachaha means only if any injuries are due to any exposure to the bahayastvachaha, then those things are considered as shotaha. Etena gambiratva doshakatva dushikatva shotena na bhavati. Here Acharya Chakrapani clearly mentioning arthapati. Bhaya means understood. If we use arthapati tantrayukti in other way, abhyantar also means deep-seated injuries. Those are not considered under the shota. Here clearly mentioned by Chakrapani. That's why this bahayatvacha word is very important. If any cuts or injuries are deep, gambira, the shota will not be produced. Okay, shota will not be. Shota may be occurred, but it should not be taken under the shota category. As if there may be a cut of mamsa, dharakala, or raktavasrotas, or siras, etc., then they are considered as mamsajanya avastha or marmajanya avastha, like any other thing. But shota or any such avastha which is caused due to the deep cut gambira cannot be considered under shota. It is clearly told by Acharya Chakrapani in Charaka Chikitsasana 12th chapter 7th shloka. Okay, so here further classification regarding the agantuja hetu, we can refer, just for a better understanding, we will refer the Charaka Chikitsa 3rd chapter 111 to 114 shloka. It's very important. Here Acharya Charaka is explaining the agantuja hetu, agantujora hetu, and also explaining some classification of agantuja types. Charaka Chikitsa 3rd chapter, Charaka Chikitsa 3rd chapter 111 or 112 maybe. Okay, Chikitsa. So here most important is that same karanas. Just to open the shloka, just to read. There are much similarity in what we read in 18th chapter 4th shloka or 12th chapter 7th shloka, and even in 112 shloka. I think 112 of Charaka Chikitsa 3rd chapter in Joradhikarana. So here most important is that same karanas, hetus or nidana which are explained here are also to be considered as shota hetu also. Here whatever the hetus we will see now, shastra, loshta, kasha, kashta, mushti. Okay, like that. Here same, once again, see the same word, it seems to be same shloka. We will once again see in Chikitsasana also. Okay, or we can say all the agantuja hetus which are explained in the adhikarana of jwara are also too applicable for shota also, and all the hetus were explained vice versa. Explained in shota adhikarana, they can be considered for agantuja jwara also. Okay, jwara hetus are generally considered for all vadis. Jwara is a Jwara is synonym for rogas also. Okay, that's why we'll say the shloka abhighata abhishangabhyam abhishanga abhichara abhishapatah shastra loshta kasha kashtam mushtim aratnilam talaha dvijaihi. See, here once again we come across similar kind of abhighata agantuja hetu. Here even jwaradikarna also. So by injuries abhighata, by abhishangabhyam means by kamadi hetus, and by abhichara means the Vedic mantra chanting, what you call tarladke. Okay, and abhichara means shapa, means by gurus or elders or anything. Okay, see, all these four subkinds of agantuja hetus can be cause for shota also, especially the first one. Because first one, that is abhighata, especially I'm speaking directly. Acharya go on explaining each four with few examples. Okay, Shastra, Loshta, same things. Once again, I don't think it's necessary to repeat here. What happens ultimately in Agantuja Jwara, that to Abhighata Jwara, will focus on Abhighata Jwara. Tadvidyasambhasha. Tad means similar. Similar means what similar? Tadvidyasambhasha. Vidyasha means Shastra, Loshta, Kashta, Mushti, some other maybe other some reasons, Abhighata reasons. You can take from your Charaka Sutrasana 18th 4th shloka, or you can take from Charaka Chikisa 12th chapter 7th shloka, or any other chapters where you will find some Abhighata kind of hetus. Those also can be considered here. Ultimately, what happens? Vrute gatre. Ultimately, what? Vrute gatre. Here, see, in Jwaradikarna, he is using the word vrute gatre. But whereas in Charaka Chikisa 12th chapter 7th shloka, Acharya use bhayastvachaha. Okay, but in the same, in our 18th chapter, we won't find such either vrute gatre, either bhayastvachaha. Okay, let's see what it means. Vrute means injury to where the body. Okay, jwara syat abhighatajaha. Due to those reasons or some other similar that reason, abhighata jwara can be occurred. Okay, it's clear. So next, how to understand this? Why I came here means, see here, by using the Atidesha Tantra Yukti, we can understand this shloka as tadvidasya vrutagatre. Okay, tadvidasya means above hetus and similar to that of hetu, when have vrute gatre, injury on the body. Body means we should remember that bhayastvacha once again. We should not forget that word. Vrute gatre means once again by using Atidesha Tantra Yukti or by using Uhana Tantra Yukti, we just remember that word here. Vrute gatre. Okay. So, and here, instead of that vrute gatre, just to remember, instead of jwara, vrute gatre, jwara shota syat abhidiyate, abhighatajaha. So here what you do? Tad vidaisya vruta gatre, just to remove jwara word and put shota, okay, syat abhighatajaha. It will give the similar meaning, what we read in 7th shloka of 12th chapter, or even 4th chapter of our 18th chapter. Here, also at last, jwarasyat abhighatajaha. See, same thing. So next, very important here, Acharya Charaka is going to explain after abhighata what kind of nisadoshas are going to affect. That is very important here, because in our either 12th chapter you take Chikisasana, either you take 18th chapter Sutrasana, they only explain abhighata, that's all. But after abhighata, what kind of doshas are going to vitiate in the body in the later means next kala. Just to give the example, just to give the reference of that, where in which Adhikarana Acharya Chakrapani told, kala means what kind of kala. Okay, so there might be some dosha involvement. So tatra abhighate, next is very important. It's very important to understand our shota also. Tatra abhighate, okay, prayuhu vayuhu. Prayu means mostly first vayu. Okay, vayuhu. By the abhighata, vayu get vitiated. first initially, prayo, maybe. Okay. And thus visheshan of raktaha, prayo vayu raktam. Okay. Next vata, what it does, it vitiates the rakta, thereby first producing vetha. In all kind of agantuja rogas, first will come across vetha, discomfort. Okay. And producing shotha. Here also shotha. See, we are in adhikarana abhighata jwara, but here shotha is there. Shotha symptoms also there. Jwara is there, of course, no doubt in it. Saruja jwaram also there, but shotha is also there. So producing shotha and vaivarnya, okay, karoti, saruja jwaram. So shofa vaivarnya saruja karoti jwaram. So along with shota vaivarnya saruja, jwara will occurs in abhighata jwara. Okay. So here further I will see how to interpret this abhighat jwara to that of our shota. Here the shota is also like that of jwara and other disease condition. Okay. Even by considering once again the Atidashantra Yukti, we just remove or replace the word from the jwara to shota, and you see and read that tadvidyasambhasha frutagatre. Here in Adhikarana of 1221, 112 shloka in 33rd chapter Jwara Chikitsa, there is a jwaraha, but just you remove the jwara and put shota, syad abhighatajaha. Same. Tad vidasya frutagatre, shotah syad abhighatajaha. Because in very next, after prayoho vahyu raktam, he explained shota once again there, no doubt. But here the similar samprapti we can see here in jwara also. So another thing here is we can see jwara also almost similar kind of samprapti that to the shota. Example, if you see that similar 114 shloka in Chikitsa 3rd chapter, jwara adhikarana, tatre vighate vayu prayo raktam pradushate. See, just remove that, just you keep side the hetus and you come to the doshas. Which kind of doshas are going to vitiated initially in abhighata jwara and even abhighata shota. Okay, so in jwara tatra abhighato jwara vayu prayo raktam pradushate. Just we saw. Okay, prayo vayu, next it vitiate rakta and later on it produces shota. And here in 12th chapter our Chikitsa Sana shota adhyaya. So bahya sirah prapya adaha kafa asruk pittani samjushati iha vayu. See, here also it's very similar. Vayu and Rakta once again are similar here. Okay, these are the very, very important factors irrespective of any shota. Vata is a prime factor. In fact, in coming discussion, how I will explain how this shota is similar to that of Vata Vyadhi. It is nothing but like Vata Vyadhi only. Okay. So Bahyasiraha prapya yadaha kafa asruk pittani samdushati iha vayuhu. So here also, when you see the samprapti of shota and jwara, we found that vayu and rakta are the main things. Okay, in producing shota, it means we need to remember and understand the vayu and rakta pradhanyata dushti shota. Let us see Chakrapani commentary, where on Charaka Chikitsa 3rd 112 only. Here, frute abhihate prayoho raktam iti atyartaha raktam pradushayan mamsadi cha alpam dushayat ityartaha. See here what is Chakrapani telling. Frute means abhighata, injury. Prayoho means every time, immediately after abhighata, first vayuhu, okay, vayuhu get prakopa or dushti, get dushti, and thereafter this vayu will very next vitiates rakta. Okay, how excessively atyartaha rakta dushyate, and thereafter they means togetherly vayu and rakta vitiate further mamsa medadi dhatus. Okay, but not excessively. Like excessively word is only for vata, bias tvacha. Just you see, if we'll go over to 18th chapter, we'll see that tvak, mamsa and rakta are the major dhatus are involving in Shota. And here Chakrapani is telling, of course, Mamsa Medadi dhatus are also involved, but not atyartha, not excessively. Like that explanation is giving in by Chakrapani in Charaka Chikitsa, 3rd chapter, 112 and 113 shloka. Okay. So, even further Chakrapani in commentary only, he is Acharya is giving some other cross reference here. Yadhyapi nidanam api. Yadhyapi nidanam api means even in Jwara Nidana also. Okay, in Jwara Nidana also, open that first chapter 30 shloka. Even he himself is giving reference. Acharya Chakrapani. Yadhyapi nidanam api. Even in Nidana Sthana, Jwara Adhikarana only, first chapter, 30 shloka. Tatra abhighata jo vayu tishtam shonitam adhishtena. He is telling here, even tatra abhighato vayu tushta shonitam. Here also, in the Agantuja Jwara, was caused by the abhighata. If the Agantuja caused by abhighata, okay, associated with vayu, okay, and rakta is the prime factor. These are the very important factor. I mean to say, we can take this as the rakta is present in the raktavasrotas. No doubt in it. Okay. The gati of rakta in raktavasrotas was gained by vanavayu. Okay. It means the vayu which is in ashita of raktavasrotas was get vitiated and vitiate rakta. In this way, we have to understand this concept. Okay. Tatra abhighatajo vayuhu dushta shonitam adhishtenena. So here, himself, Acharya Chakrapani, while explaining Charaka Chikitsa, 3rd chapter, 1112 to 113 shloka, on that commentary, here giving cross-reference regarding the Jwara Nidana. So, Acharya Chakrapani, here the second doubt comes, what is the need of giving cross-reference or further clarification of word Vayu Prayo Raktam? Okay. So here maybe first reason I think want to tell us that the word Agantu means it includes others also, not only Agantu means always Abhighata. Other than Abhighata, it also includes Agantu means Abhishanda, Abhichara, Abhishap also. Okay, those won't come. This kind of description we won't find in anything other than Charaka. What you call in Jwara. In Chara only, I think this kind of description detail will be found, not in other things. But by using Tantra Yukti, we can apply everywhere. If we want to understand the concept clearly, we need to go through all the things. And maybe second reason, maybe here among four Agantuja Hetus, Acharya Chakrapani indirectly telling that, especially in the context of Shota, there is a major role of Abhighata rather than other things. Other three things. There is no such role. I think so. So that's why Acharya Charaka maybe in 12th chapter 7th shloka also explain the same thing. So further to know the clear idea and clear cut knowledge of four kinds of Agantuja Nidana, like how they are causing samprapti. Just you see, if you divide the four among two categories, Abhighata is the only Nidana which is caused by Murta Dravyas. Maybe it was Sambhasha, it may be Abhighata, like anything Murta Dravya was there. But whereas Abhishapa, Abhichara, Abhishanga, it's not like it is. This is the Hetus where there is no such Murta Dravyas. Okay. So further clarification of word Vayu Prayo Raktaha, Prayo Vayu Raktaha. Here first. We see the scene Shota only. As we are studying in Shota, just we go to see Shota. When we saw the 18th chapter, the 4th shloka, last word, Shotam Sampajayate. Okay. Wrote directly, Shota will get Utpatti, like that. Okay. Why? Because we already discussed generally in Bahaya means Agantuja, that too especially Abhighataja. Okay. First, Vetha, the Lakshana, get Utpatti. Get produced, and later the dosha will get involved. So similarly, here Acharya Charaka in 18th chapter 4th shloka, not at all mentioned at least after Abhighata which kind of doshas are going to produce here. So to know the knowledge of doshas after Abhighata, we need to refer this Adhikarana. It's very important. Okay, here we will find that reference. When we notice and read word by word of that shloka, that is Charaka Sutra 18.4, and if you go further and next shloka, very next shloka in Sutrasthana 18th shloka only. Okay, there himself Acharya Charaka further give clarification for the same, and except only in Charaka Sutra 18.4, directly Acharya wrote main word tatra agantuvaha, broad word, not abhighataha. Similarly, in very next shloka, as I told, in Charaka Sutra 18 chapter, 5th shloka, very next, after 4th. Here also, Acharya indirectly wrote the word, indirectly wrote word agantuva. Okay, abhighataha. So that means te punaha vetastaha. That means that the above, that is agantuvaha. So in the both shloka, either direct or indirectly, Acharya wrote only broad main word agantuhu, not found abhigataha or any kind of form. So, but when we go through the Charaka Chikitsa 7th shloka for further agantu nidana of Shota, here in Chikitsa in 7th shloka, here first word found abhigataha, not agantuvaha. Directly wrote. Okay, because as just we discussed earlier, mostly or mainly among 4 doshas, among the kinds of agantu nidanas, mainly abhighata has a major role in samprapti of Shota Utpatti. Maybe this reason, in this context of Shota, Acharya Charaka, among 4 kind of agantuhu, explained abhighata only, I think, in Charaka Chikitsa 12 chapter 7 shloka. Okay, so see, all 4 kinds, it's so seen even in practice also, commonly in practice, what happens, we come across so many cases where we will try to elicit the cause of diseases in all aspects, seriously. But some of that, sometimes we could not find out any important causes. It's very hard. Sometimes what happens, we go on asking so many questions, so many related things. We couldn't find any prabala hetu, particularly aharaja viharaja. At that time, it may be abhishapa, abhichara, so maybe some other things also. Because in Kushta, Acharya Charaka told Pura Janakruta, Chura Janakruta Papa, or Shapa, or Guru, like that. He told some, what he called, Amurta Dravya Hetus also. So, even the patients cannot tell those things. They don't know because they don't have knowledge about Abhishapa, Abhichar, like that. And or even the physicians also cannot ask same Hetus in detail. So, hence it is very difficult to find such nowadays in practice. Only Anumana can be drawn. That's all. Hence, these are the Agantuja Hetus which producing Shota. So, next we'll move to our Charaka Sutra 18th, 5th shloka, as I told. 5th shloka now. Adhikarana is a continuation of Agantuja Hetu of Shota only. Okay. So, te punarveta yathasva hetu venjanaihi adava upalabhyante nija venjanaihi eka desha viparitaihi. See, here, once again, he is giving some other type of hetu and his chikitsa also here. See, te punar yathasva hetu venjanaihi adava upalabhyante nija venjanaihi eka desha viparitaihi. What is telling? In the beginning, they are known by their characteristics sign of injury. Okay, and differing from Shota caused by the Nija Shota. So in the beginning, Agantuja Shota has a specific characteristic features, and even the Nija Shota is also having specific characteristics. Okay, so that's why te punar ethasva, using the word. So, but after sometimes, few seconds or maybe minutes, what happens? They are intermingled. Okay, of course, for Hetu is Abhighata, that's why we are keeping it separate, that's all. But very next, once again, there is an involvement of dosha. So, it will become very difficult to nomenclature whether this is Agantuja Nija Shota. Why? Because for Agantuja Hetus, there is an involvement of Nija doshas, no doubt. And even for Nija Shotas, Nija Hetus, there is an involvement of Agantu Hetus also. Vice versa. See, just for reference, clarification, Charaka Sutra 19, chapter 7 shloka, Agantuhu Anveti Nija Vikaraha Nijas Tatha Agantu Api Pravruddha. See, it's clearly mentioning there is a chance of Nijabada, means Anubandha, involvement of Agantu Hetus, even there is a chance of Agantubada involvement in Nija Hetus also. So further, Chakrapani in the same Adhikarana, he is giving further clarification with example, like how Nijam Pratama Samutpannam Vikaraha Agantu Bhutadijanya Vikaraha Anveti Anugate Bhavantihi. Means, in fact, overlapping of the Nijas and Agantuja rogas are seen occasionally. Okay, so it is seen that if diseases are originated as Nija rogas initially, and it may be subsequently develops the features of Agantuja rogas also. Example, if you see, best example, Kripani himself is giving example there. Yatha doshajo eva jwaraha unmad eva paschat bhuta nivesha abhibhavanti. See here, initially dosha and unmada are caused by Nija doshas, but later in both even doshas, even jwara and unmada, there is a secondary involvement of Agantu Hetu also. Example, you see just which one shloka, that is Charaka Chikitsa chapter 12 shloka. There you will come across involvement of infection like Agantu Hetu. Just you see the Chakrapani commented last. Bhutas. There he explained given the references of Charaka Chikitsa 12 chapter, Chikitsa 3rd chapter 12 shloka. 12 chapter 3rd shloka. There what Acharya Chakrapani wrote? 12 shloka, very fast. Third 12 shloka. Okay. See here. Dehinam nahi nirdosham jaram samupasevet. See, Dehinam nahi nirdosham jaram samupasevet. Here in Chakrapani, just to see the last word, samupasevet iti bhashaya bhuta vishesha rupasya jvarasya eva Jwarasya avesham darshayati. Here, as I told, of course, jwara is caused by Nija dosha. But in later, when the dosha, Vishesha doshas are there in body, then there may be Vishesha jwarasya avesham darshayati. Which avesha? Bhuta vishesha. Avesham darshayati. And even unmada also. So, first this jwara example just is giving example, that's all. Even we can see in Shosha, we can see in Ekshma, okay, we can see in so many diseases. So, dosha eva jwaraha unmade, but va paschat bhuta, what is called, bhuta nivesha api bhavanti. And that vice versa. Example, tatha agantu utpanna abhighata jwara, bhutam cha unmadam, paschat eta asadhyam nijo api tatra dosha lakshanam lakshato gado bhavanti. It's vice versa. Even similarly, jwara caused by abhighata and unmada caused by bhuta may subsequently develop features of Nija rogas. Because ultimately, say, hetu may be nidan or Nija or agantuja, but ultimately we have to treat dosha only. This is the fact. Okay, so this kind of things are, this kind of changes were there occurring in our Nija and Agantuja. So, in clinical practice, just imagine any person hit by an iron or simple pin. Just you take a small pin, not big thing. Okay, what happens if you prick him? What very next is expression is severe pain, intense pain. Pain, why pain? Because see, later means what kind of later? It may be 1 hour to no. Within a fraction of second, pain will be there. Pain, why? Because pain is the lakshan of vata dushti only. Without vata, there is no shula. Okay. So very next after vata dushti, immediately rakta will get dushti. So that's why in Charaka Sutra 5 chapter 87 shloka, sparshana adhikobhyam vayu sparshanam tvagashitaha. See, vayu is svagashitaha. So whenever there is a bhayatvachah, wherever there is an injury or samsparsha, anything pathology, anything hetus will first vitiate vata. Okay. So here hetus in agantuja, here hetu in agantuja, but seen immediately nijadoshas, vata, like shula, shota will get prakopa, and that's why Acharya told agantur anveti nija vikaraha. So it is quite common. So it will not take much time. Okay, it will occur instantly or immediately followed by abhighata within a few seconds maybe. But in other abhighata maybe like abhishapa, abhichara, abhishanga, we don't think we don't have shula like vetha or symptom, but maybe in coming days, maybe minutes, maybe months, maybe years, unmada, apasmara, or even jora, maybe depending upon severity, which kind of even agantuja, it depends upon that hetu, the samprat will carry on. But hetus may be agantuja, but chikitsa should be done only dosha. It is the clear-cut core of our Ayurveda. Doshas we have to treat. And see, just now I told, same in Charaka Nidana, first chapter, 30 shloka, Chakrapani has beautifully quote on quotation, Sa kinchit kalam agantuhu. So, what kind, how much time it take? As I told, it may be depending upon hetu. Sa kinchit kalam agantuhu. Agantu, only certain period only. Later it becomes Nija only. So, this is important here. Chakrapani, kinchit kalam iti stoka kalaha. So here see, kinchit kalam iti stoka kalaha, and a short period, small, it may be frequent, a fraction of second also. And according to some other scholars, they are opined trayo vadanti anya saptaha, maybe, but these are the chronic kind of acute, not acute kind of samprapti. Here maybe jwara or some other disease, they may take 7 days like that. So in this context of jwara, it may be 5 or 7 or 5, 3, 7 maybe, but in the sandarbha of context of adhikana of shota, especially particularly the abhighata shota, it is quick, instantly. Whenever you come in contact with any allergens, immediately you get symptoms. Means because why? Because of vata and immediate rakta. Okay. So further Chakrapani explained, tasya yasya aganto yoho pasyo doshanubandha bhavati. Here clearly mentioned. It doesn't mean that after kala means kinchit kalaha. Immediately, stoka kala, short time, immediate doshas get involved. Okay. So later dosha anubandha occurs. It is final. So with this, I'll two more main shloka. Fifth shloka. So time is So next shloka, Charaka Chikitsa, 18th chapter, 6th shloka. Time is 8. You have started with then we can try the time also. Continue. Okay, no issue. Excuse me. Hello, doctor.
Yes, sir.
Can I continue or what to do? Because now it's around 7:50.
So if you want to continue, you can, sir.
I will continue for 10 minutes. Tomorrow.
Sure, sir.
Huh? Okay.
Sure,
just I'll cover one shloka, 6 shloka. Later on, I will discuss tomorrow.
Yes, sir. Yes, sir. You can continue.
Okay. So we'll come to our Charaka Chikitsa, 18th chapter, 6 shloka. That is now we move to our here from 4 to 5, and even we saw Charaka Chikitsa 12, 7 shloka, all about agantu hetu. Okay, and even meanwhile we saw the Charaka Chikitsa 13th chapter 112 to 114 shlokas, and even Idanasana 30 shloka also. So all this the things are important further in understanding Samprapti of Shota. It's very important. Otherwise, we won't have that clear-cut idea what things are going on, how changes, what kind of changes are going in our body. So here, after completion of our Nija Hetus, we'll move to Samprapti. So there we'll discuss those things are important once again. So Charaka Chikitsa 18 chapter 6 shloka Adhikarana is in the Shota Hetus. Nijaha Punaha Sneha Sveda Vamana Virechana Asthapana Anuvasana Shiro Virechanam Ayathavat Prayogam Mithya Samsarjanadva. See, first word till we'll read one by one. Here, Nija Punaha. Okay. The hetus of Nidanas are Punaha, once again, Sneha Sveda, Vamana Virechana, Asthapana Anuvasana, Shiro Virechana. What Virechana? Ayathavat Prayogam. All of the above procedures, if we use Ayathavat of Snehana, Ayathavat of Svedana, Ayathavat of Vamana, Ayathavat of Virechana, Ayathavat of Asthapana, Ayathavat of Anvasana, and even Shiro Virechana. All due to all this Ayathavat Prayoga, and even not only Panchakarma, Pradhana Karma, even Samsarjana, Mithya Samsarjana Dva. Okay, this is the first line. Here, see, this is just to notice, you have noticed that just to see first things, first Panchakarma, Ayathavat Prayogas are important here in first Hetu for your Trishotha, here Trishotha. Even we can see these things in Kushta, Gulma, or Prameha, so many things. But here, nobody, no Acharyas has given priority, first priority for Panchakarma, Ayathavat in other diseases. Of course, they are there in so many diseases. But here, Sneha Sveda Vamana Virechana Asthapana Anuvasana Shiro Virechana, Ayathavat Prayogam, and even Mithya Samsarjanadva. Mithya Samsarjana, this is also a kind of Sampra Hetu in so many diseases. So Acharya Charaka was given, these are the first and Hetus explained as the first Hetu, so Nija Hetu. So what message here you want to give? See, this is very important for practitioners, those who practice Panchakarma. Okay, this is very important. And even for practice, whenever the case comes, we need to remember these Hetus here in our mind, because without knowing the Hetus, we cannot ask the history, because what kind of questions we need to ask, we don't know. Because Shastra is telling different things, we are asking different things. Somewhere the gap in between, we are missing the main things, and we could not we could not find the Prabala Hetu or main Hetu of the Vyadis. So here it shows that in the ancient period also, people are much aware of Swastha Panchakarma. So many may take Rutu Anusara Shodhana also. That's why this ancient period first given means they were much aware. Even if they are fit, in Vyadhigrastha also patient may undergo Panchakarma procedure. It might be the routine things. It's common in ancient period. If in that condition, if Vaidya not conducted Panchakarma, when Utklesha Avastha or Rutushodhana, if you are not done, okay, what happens? Patient may develop one or other Upadravas. Among one is Shota also. Okay. And further, whenever there is a Shota pain comes to our clinic, then now it is mandatory to ask about you have undergone any Panchakarma procedure at least within 6 to 8 months. Okay. See, our objective is not to blame anybody. Okay. So just as a formal, it's better to ask which kind of Panchakarma have undergone. Have you found any kind of difficulty during procedures? Like procedure means even may Pura Karma, during Snepana or Abhyanga or Sweda, or may Pradhana Karma, or even Parishad Samsarjanadva. Okay. If so, what kind of symptoms you have developed? After Panchakarma, your Mula Vyadhi has subsided, cured or not, or controlled or aggravated, or any increase in your symptoms, like that. So taking history is a mandatory. After reading all those things, I think it's very mandatory to roll out all the Nidanas in Shota patient. About Panchakarma, okay, especially. And nowadays in cities, everybody know, Ayurveda Panchakarma centers are offering packages like, okay, so Vasant Ritu Vamana, Vasanti Vamana, Sharat Vamana, that they are doing so many packages. In fact, the patient is needed, fit or unfit, they won't see. That for the commercial, for benefit, the doctors unnecessarily advising one or other procedures, and patients are land up in so one or other issues. So This is mandatory for taking history also, okay, after reading all those things. And mithya samsarjanadva. In samsarjana, if samsarjana is not properly followed, okay, then this is also one of the cause for.
Sir, if by snehana and all shota occurs, then why in any vyapat the shota lakshana have not been given, sir?
Where am I?
In vamana virechana and all, if we do, if we not do proper prayoga, then it will lead to shota, no, sir. Then why in vamana or virechana vyapat the shota they have not given, sir?
Just to note down this question, I will ask. I think by tomorrow evening you will get clear all the things, because shota means that is the main thing here. See, in vamana ayoga, what are the symptoms? Spota kota kandu, isn't it? It is ayoga. So spota kota kandu utseda matra samanyat. All the rashes, whatever the things, okay, occurring changes in body, those are all nothing but shota only. Shota means don't expect that. That's what I want to tell. That's why in starting, in the introduction I gave, that shota is not simply pedal edema like that. Just by tomorrow evening, after completion of this chapter, I think you will definitely get the answer of this question. Okay, just to note down again.
Thank you, sir.
If you won't find answer, just I will answer it tomorrow. Okay, ma? Fine?
Okay, sir.
Definitely you'll get idea. And just even pradeshika shotas we have to go and discuss next. Okay?
Okay, sir.
And for further in 12th chapter, we'll get everything. But most of things are here only. And your question answer is here only. Shota, first we need to try to understand what is shota. Shota, that is our, because we just use samskara, we just remove our old samskara. Just try to understand what Acharya Charaka is studying. Shota means what. And later after completion of the chapter, we'll discuss. Okay? Fine? Shall I move? Continue? Hello? Doctor?
Yes, sir. Yes, sir. You can continue.
Okay. So, in samsarjana, if not properly, mithya samsarjanadva. If samsarjana is not properly followed, then also the shotame occurs. First and foremost, nija hetu for shota is panchakarma mithya. Okay, in samsarjana. So next he is giving set of some vyadi. See, first line, first is explaining about some mithya, means ayata prayojana procedures. In the next, he is giving set of diseases, means they are nothing but paratantra vyadi. Paratantra hetu of shota. Okay, they are not what you call swatantra hetu. They are chardi, alasaka, visuchika, swasa, kasa, atisara, shosha, panduroga, udara, jwara, pradara, bhagandara, arsho, vikara, atikarshana va. See, this atikarshana was a very important word here. Simple atikarshana is not separate word. Okay, due to the chardi, the patient may become atikarshana. Due to alasaka, patient may become atikarshana. Due to visuchika, patient may become atikarshana. Due to chronic swasa patient, kasa patient, atisara, shosha, panduroga, and udara also. And all doshas, jwara also, jwarakshinasana hitam namuna virechanam, even jwarakshinasana hitam. So the patient became kshina due to all the above diseases and maybe some other diseases also. If the patient became weak, what happens? Ultimately, dhatukshay will be there, snehakshay will be there, vata prakopa will be there. So we'll see. Just to remember these things, they are helpful in our samprapti. Okay. Ultimate, see, while reading, don't read. Atikarshana is a different thing. Atikarshana is caused due to these things. Maybe some other things also. For an example, Acharyas put some diseases there. It doesn't mean only because of the disease the patient become atikarshana. No, even Rakta Pitta patient become atikarshana. Even due to some other than this, so many diseases, patient may become atikarshana. Okay, even upvasa, atyupvasa patient become atikarshana, because ativyayama patient become ati. But there are so many things. Ultimate thing is atikarshana is very important word here. Just to remember this will help in our samprapti. And next, kandu, see, kushta kandu pidikaha. Here kushta is there, pidika is there. Okay, see, when you see, just I told some doctors asked me, shota means. Even in ayoga, woman ayoga, spota kota kandu, prutka vishta gurgatata. Spota kota kandu, spota kota, nothing but they are also the eka pradeshika shota only. Okay, here kushta, kandu, pidika adibihi, va, okay, pidikas are there. And next is giving set of vegas. Due to vega dharana, shotame occurs. Okay, vega ultimately, so vega dharana, what happens? Udavarta is the main common. Okay, especially for purisha or mutra, vata mainly. Okay, so udavarta will produce. So chardik shavatu udkara shukravata mutra purisha vega dharanaihi va. Okay, next, due to the above vega dharana, ultimately what happens? Vata will get prakopa, and these are the hetu for shota. But next, once again see karma. The word karma once again indicating panchakarma only. Okay, roga, panchakarma, roga panchakarma, upavasa advakaršitasya va sahasa ati. Swahasa ati guru amla lavana pishta anna. These are the same thing. See, next set of things are giving here directly. See, first, because of diseased, secondary diseased, he has become weak, atikarshana, and here because of some activities. So in that panchakarma maybe ayathavat means ayoga maybe. Here when you see the karma word with upavasa, atikarshana, sahasa, there seems to be atiyoga of panchakarmas, maybe, it's my opinion, because here in the set he wrote, Acharya wrote with upavasa, advakarshata and sahasa. Here maybe due to once again the vatu will prakopa, snehakshaya and dhatuksha will be there. So next, ati guru amla, some ahara, he is giving the nija hetu now, the swatantra hetu, these are swatantra. Ati guru amla lavana pishta anna phala shakadi agada dadi haritaki madhya mandaka viruddha navashuka shami dhanya anupa audaka pishita upayogan. See, here now this from ati word is important. Ati is should be used for all things. Ati guru, ati, see, normal amla lavana, it won't cause any disease. Okay, so normal tatruksha lagushita, the gunas are normal, they won't cause any disease. Similarly, when they became ati, then will the problem start. So here guru amla lavana pishta, whatever the ahara they to expand here, just put ati guru, ati amla, ati lavana, ati pishta, everything. Okay, so on. So excessive. So excessive walking, one of the advamas, it's okay. So then what happened ultimately? See, basically whatever the various causes of vata prakopa due to respective hetus, either swatantra or patantra. Till now we saw everything for
last.
So just I'll come to that. So ultimately there may be swatantra or paratantra. Then that V-shaded prakopit dosha, okay, move towards the bahya siraha along with V-shaded pitta, rakta and kapha and produces shota. Okay, that's why shotam, shofaha pradurbhavanti ityuktam samanya hetu. This is samanya hetu. Just we'll discuss about specific vishesha hetu also. This samanya hetu, we'll discuss vishesha hetu also. So next so next, mrutta panka loshta bhakshana lavana atibhakshana garva sampidanat am garva prapatana prajatanam cha mitya upacharad. Okay, these are also explained here after that aharas. So here some kind of some accidental like garva sampidanat, okay, garva am garva prapatanat, or prajatanam cha mitya, due to what you called improper antenatal care, or due to some abortion, okay, or some mrut means what you called it, mud or panka, loshta, bhakshana, by eating those things, atilavana bhakshana, okay, all these are the causes explained under the heading of samanya hetu shota by Acharya Charika. So what happened next? Due to all this, or maybe some other things, ultimately, udira doshatvat shofaha pradurbhavanti ityakta samanya hetuha. What happens due to the all above hetus? Either maybe one or two or combined, depending upon the hetus. Due to the above hetus, the doshas will get aggravated and causes nidashota. Okay. So, same, just I'll conclude here. Just the same nidanas we come across in Charaka Nidanasthana, first chapter 28 shloka also. Here, just to see some Sannipada Jwara Hetu, then Adhikarana, Acharya Charaka, once again explained, Mithya Samsajanadva, just similar, same word, Mithya Samsajanadva. That's why I told, Shota Hetu, Shota Samprapti, Shota, especially Abhighata Jwara, almost are similar. So, Mithya Samsajanadva, Stri Na Cha Vishama Prajatanam, Prajatanam Cha Mithya Upacharanam, same Hetu, Yatoktam Cha Hetuna Mishri Bhavad Atha Nidanam, Dwandajo Nama Anyomataha, Sarvava Trayo Dosha Yugapat Prakopante Apadate. See, because of all the above Hetu, Sarvaiva Trayo Dosha, all three dosha, Yugapat at a time Prakopam Apadate. So, okay. So, similar kind of hetus we can found in Sannipada Jwara also in Nidana's first chapter, 28 shloka. So, ultimately, that's why Acharya Charaka in Sutrasthana 18:6 shloka, at last he used the word, what that is, Udina doshacha shofam praturbhavanti ityuktam samane hetuhu. Means, what are all which are explained in Charaka Sutra 16:6. Okay. All hetus which only vitiate doshas, that's all. Okay. But they are not causing the shota. They are, see, here in this Adhikarana, what we saw, they are doing only shofam pradurbhava ityakta shofam pradurbhavanti ityaha saman hetuhu. Okay. So next, so similar description, it is better to once refer Charaka Chikitsa 12 chapter 5 to 6 shloka, same hetus, but we'll discuss tomorrow. I think now time is 8:10. We'll continue tomorrow our topic. Okay, and anybody, if you have any doubts, just you note down, and or you put in your box, so that I will answer at last. Okay, Doctor?
Yes, sir.
Can I stop?
Yes,
Tomorrow, please message me at what time. By evening, I'm free by 5:30. Okay? We'll try to conclude tomorrow. If at all remains, means I'll continue day after tomorrow also. Okay?
Okay, sir. Sure, sir.
Thank you. Thank you, Anand.
Thank you so much, sir.